So good afternoon, everyone, and I'm absolutely delighted to welcome you today to the TAIBU Community Health Centre with Minister Patty Hajdu, Canada's Minister of Health. I'm Gary Anandasangaree, Member of Parliament for Scarborough, Rouge Park, and also a proud member of the Black Parliamentary Caucus. Over the past 5 years, we've worked very hard with the government to advance issues that are of importance to the Black community, particularly in addressing systemic and anti-Black racism. So today's announcement is really an extension of the work that we've been doing. As you know, yesterday the Prime Minister announced $21 million for support for Black businesses, and we're working on significant changes to the systems that affect and limit the Black community attaining their truest potential. So I'm very glad to be here with all of you and with my colleagues. First and foremost, the Honourable Bill Blair, who's the Minister of Public Safety and the Member of Parliament for Scarborough Southwest. We have the Honourable John McKay, who's the Member of Parliament for Scarborough-Guildwood. Salma Zahid, who's the Member of Parliament for Scarborough Centre. Jean Yip, who's a Member of Parliament for Scarborough Agincourt. And unfortunately, Sean Chen, who's the Member of Parliament for this area, is not here today, is unavailable today, but he sends his wishes for this event. Without further ado, I'd like to introduce the Honourable Patty Hajdu. As you know, she's been the front and center and the face of this government within the past 6 months. As we fought and we've done quite well in addressing the challenges of COVID-19. She's shown enormous leadership, not just in Canada, but around the world in her work. And I'm so delighted to have her come back to Scarborough, come back to Malvern once again to speak about this very important issue to address systemic racism in Canada. Minister Hajdu.
Windy, we have masks on. It's an unusual announcement, but it's such a joy to be here with you in the traditional territory of the Ojibwe, the Anishinaabe, and the Mississaugas of Port Credit. And it's also such a pleasure to be here at TAIBU Community Health Centre in Malvern, in Scarborough. And thank you so much to Liben and Natasha, who's I think back there somewhere, for sharing with me a bit about the work of the community centre and its history. What tremendous work on behalf of the community the organization has done over the past 11 years. And I have to say, coming from a community that has a community health centre, they are truly treasures across Ontario. And I'm so thrilled that TAIBU has such a rich and profound connection to the community it serves. It's also a joy to be with my colleagues in person. We've been Zooming a lot like the rest of the world, but it's nice to see people's actual live faces. Of course, Sean couldn't be here, but Gary and Minister Blair, who I have the privilege to serve with in Cabinet, and Jean and Salma, and John, who is here as well. You know, I have a phenomenal team. I'm so lucky to do this work on behalf of this country with these incredible professionals, and the people you have representing this community are really stellar, passionate, hardworking fighters for the region, and you're very lucky to have these elected officials talking on your behalf. This year, World Suicide Prevention Day is a really important day. It is every year, actually, but we know that even in normal times, Canadians struggle with mental health issues, with depression, with anxiety, and of course, far too many Canadians take their own lives. But of course, during COVID-19, it's only accelerated the challenges that people are having with mental health issues, and in particular, we've seen the rates of suicide go up since the emergence of COVID-19. And so this means people need more help and they need more support. And governments, know that there's an importance of promoting mental health and increasing health equity, in particular among children, youth, and their caregivers. But all too often, targeted investments are not made, and things are bucketed in big buckets that don't really get at the unique and particular circumstances of individual groups of people. And so that means good programs like the ones offered through Natasha and in particular through Liben's direction end up struggling to sustain their supports for the people that they're working with. And what really and profoundly saddens me as the Minister of Health and as someone who spent 9 years in public health is that these programs actually prevent worsening problems down the end for people, for their families, for the community, and for the country. And they actually diminish our capacity as a country because it means that not everybody has a fair chance to succeed. COVID is also exposing the cracks and the inequities around the world and right here in Canada. And those on the front lines, we've thanked them a lot. You've heard people thanking the frontline workers, not just the healthcare workers, but of course the people that are keeping the shops open and delivering our food and making sure that the lights stay on. Those on those front lines are often the most vulnerable. They often come from racialized communities, and they're often made up of lower earning women and newcomers and people with language barriers. And we also know that this group of people has faced higher rates of illness, not just during COVID-19, but certainly exacerbated by COVID-19. And they often don't have the kinds of living conditions that allow them to stay safe themselves and to protect the health of their families as they serve all of us on the front line. Racism and anti-Black racism literally makes people sick. Higher rates of illness, including mental illness, and not surprising when people are excluded and face systemic barriers at every corner, including employment, access to health care, and other community resources. And Liben and I talked about that. You know, in particular, he talked about it through the experience of people living with sickle cell anemia and facing barriers to care. First of all, in their primary care physician office, and then at the emergency room. And as he spoke, I could think of the experiences of Indigenous people in Thunder Bay. Same story. The systemic barriers to care literally kill people in this country every single day. And this pattern has to change. Canada can only reach its true potential when every single person has a fair chance to succeed in this country. So that's why I'm so excited to be here today in Malvern, in Scarborough, at TAIBU, which is a community health center that has an approach that's near and dear to my heart. TAIBU meets people where they're at, and they tackle racism head on as a social determinant of health. And so today, to help TAIBU and organizations like it deliver culturally appropriate care, I'm happy to highlight an $11.5 million investment in mental health funding by the Government of Canada. Now, this investment will help develop and implement culturally focused mental health programs like the one Natasha told me about inside for Black Canadians all across Canada. TAIBU will receive $800,000 of this money for their youth-focused mental health and awareness support program, and this is delivered through community organizations across the GTA that serve Black youth. And finally, I just want to thank organizations like TAIBU and the incredible people that work for them, because the work they do is hard. They meet people who are suffering. They meet people who are excluded, and they put their hearts and their souls on the line. I did that work too in Thunder Bay, and I can tell you that it takes a personal toll. So we owe a deep gratitude of love to the people that are taking the time and their own personal energy to serve their communities in ways that does come with a personal price. So we can keep doing it too. If people like Natasha and Liben and all the wonderful people that work at TAIBU and in organizations like this all across the country are continuing to do this hard work in even increasingly difficult circumstances with people who are struggling even more, then we each can think about how we can lend a hand to someone in our circle. Lend a hand, lend an ear, lend your heart, because people are lonely and people are scared. But investments like the one that I'm announcing today will ensure that more people, specifically people that have been systematically excluded from systems that are designed to serve all of us, it will ensure that these people have someone to reach out to, and that more people will have new ways to cope. Because we will get through this together, but we have to be intentional about it. It won't just happen.
Good afternoon. My name is Liben Gebremikael. I'm the Executive Director of TAIBU Community Health Centre. It is a great honor and privilege to welcome the Minister here today to make the announcement. I'm really encouraged by the conversation that we had earlier on but more so around the investment that the Canadian government is really making to address the issue of anti-Black racism in our communities in various ways. And today I think we've seen one of the ways is through investment in communities, in programs, and particularly in the youth, the Black youth that are facing extreme challenges that has now been exacerbated by not just the COVID pandemic situation, but also what we have seen happening in our cities and across the world around the Black Lives Matter movement and anti-Black racism and the impact of it. So it is a great honor for us. TAIBU is a Swahili word that means be in good health, and the visionaries and the founders of this organization really had envisaged about 15, 20 years ago to have a center that is dedicated on addressing the anti-Black racism that we face as a community, whether it's health, whether it's education, whether it's employment, the broad definition of health in its terms. And to come 12 years now to where we are today in what we see around us, the changes that have taken place, some of the improvements that we've been able to do with the community, whether it's our young people, the seniors, or the adults, through our primary care or community programs, has been significant, and we're kind of proud that we have been able to do that. But we also know that there is much more that we need to do. And so announcements like today, where we have additional resources being committed by the government, is very important. It's not just the money, but I think the partnership that we can develop with government to continue this kind of work is significant. There is a lot of more work to be done. One program is just one program, but we need to think about the system and what is happening. So additional resources that are coming from the government. Today we have an announcement, a great announcement from the federal government through the Minister of Health, and we're very, very encouraged. We're very appreciative. We would like to say thank you on behalf of the board and the staff of TAIBU Community Health Centre. We really want to say thank you for the investment. Thank you for paying attention. Thank you for listening to the community and responding. We're also very encouraged by the response that we got from the federal government for COVID response, which was very, very important. We serve very low marginalized, low income communities that have really greatly faced challenges through this COVID pandemic situation. So we're very, very grateful. We'll continue the work that we do. We have the community behind us. We have a great staff behind us, and we have a very strong board and governance behind us. I would just like to acknowledge our Vice President Valerie Noel, who's also among the group there. So thank you very much, and thank you very much for the investment.
Questions on?
Hi, Minister. Suicide is the second leading cause of death for young people 15 to 24. Hi. And obviously the announcement today is a lot of money to go towards that, but is it going to be going right across the country? And if the pandemic drags on, is more money going to be made available, as experts say that these sort of mental health challenges might continue, as sort of an echo pandemic after what we're seeing right now?
Well, thank you for the question. And without a doubt, early on, we knew that COVID-19 and the kinds of ways that we were going to have to combat it would lead to an increasing experience of poor mental health outcomes for youth, as you mentioned, but for many, many people. And so we immediately transferred millions of dollars to provinces and territories to augment what they were doing already, and then launched a national platform, an online platform for people to access resources that we continually add to. And that's It's the wellnesstogether.ca portal. I wish more people knew about this portal because it is actually not just a series of online tools, although there is that. You can do a wellness check of yourself, but there's also direct connection to paid professionals that we're procuring on behalf of the federal government to provide one-on-one supports in a variety of different means, whether it's texting, phone calls, online, virtual care. And so we're going to continue that work. We're also seriously concerned about the rate of opioid overdose and an increased rate of substance use overall that we're seeing early on, including alcohol use. So yes, this is an area of focus for me that's profoundly important because, as you mentioned, getting through COVID-19 physically is one thing, and we also have to make sure that we're making the right investments with the right partners like TAIBU to reach people, to support them through the pandemic and the recovery stage afterwards.
I also just want to ask one more question on behalf of a colleague. Yesterday, We Charity, as we know, announced that they're ceasing their Canadian operations in part because of the political firestorm. As a member of cabinet, you approved this agreement. And do you take any responsibility for the closing of the We Charity in Canada? And how do you feel about it shutting its doors?
Well, listen, I can't speak to the decision of the organization and what led to that decision. I certainly think that it's important that we have charities and not-for-profit organizations that serve youth across the country. And, I wish them well in their endeavors.
Any other questions? Thank you very much.
Thank you very much.